So the history of AIDS in South Africa begins in 1950 when HIV-2 was believed to have jumped from animal to man, and then in 1998 the first large-scale test of HIV medications on people began. A year later, in 1999, the country's prime minister rejects the bulk purchase of Western ARV medication, and in 2000 South Africa becomes the center for one of the largest AIDS outbreaks. In 2002, AIDS is the leading cause of death for people 15 to 59, and in 2003, U.S. President Bush reveals plans to combat the epidemic in Africa and Caribbean. What is AIDS? Well, AIDS is the second stage of HIV and can make you more susceptible to diseases and illnesses.
So why is AIDS an issue in South Africa? Well, one reason is because of the lack of distribution of condoms to both males and females. There are programs in place that help distribute condoms to South Africa, such as the National Male Condom Program that has been implemented since 1992. While condoms are available, men and women are not necessarily given the knowledge of where to find them. The second reason is that people just don't know about the risk. Even if they knew about the access to condoms, men and women are not exactly aware of the risks that they are taking when they have unsafe sex. Men and women are not being educated on the risks that they face for unsafe sex. 95% of males and 93% of women are aware of AIDS. However, 70 to 80% do not know how a condom can prevent transmission. Between 2005 and 2008, accurate knowledge about the prevention of HIV and AIDS transmission and condom use declined from 60% to 25%. So what is being done for the prevention of AIDS? Well, as of 2017, billions of dollars have been spent in HIV/AIDS vaccination and medication research, along with the changes to help increase poor countries' access to these life-saving drugs. Increasing push in advertising and warning the public in these AIDS hotspots of the dangers that they may put themselves and others in. Even with all of this, there is still the popular thought among the people that it could never happen to them. This is what they might say back to their decision to not understand the risk that they are at.
So now we are going to be switching over to what can be done to stop AIDS. So there are a couple different ways that kids can get AIDS. So one of the ways that kids can get AIDS is through mother-to-child transmission, which is MTCT. This basically means that a child can become infected with AIDS through pregnancy, birth, or breastfeeding. So even if a mother has HIV and she decides to have a child, she is putting her child at risk for getting HIV and then it turning into AIDS as well. So approximately 15 to 30% of children with HIV-positive mothers will get that disease. Now that may be a bit of a smaller percentage for South Africa than some other African countries, but it is still very significant, and you don't want your child to be getting AIDS. So AIDS can be prevented by providing antiviral drugs, which can help kill the disease before it starts, basically. Basically, continuing with this issue, HIV-positive women are suggested to take antiretroviral drugs to prevent MTCT. These can be significant because the treatment can also be given to newborn babies for a short amount of time to reduce the chance of getting infected. So basically, what nurses do at hospitals in South Africa is they will give the babies that are just born these drugs. So this can help them prevent HIV, even though their mother might have it. So it's really recommended for the HIV-positive women to take these drugs to help prevent MTCT in the first place so that their newborn babies don't have to have this treatment. So the drugs have been proven to decrease the rate of MTCT from 35% to 2%. Now this is a very significant decrease, especially for South Africa. It's one of the highest decreases on the whole continent. So this helps because other countries should be following this method of taking the treatment and giving the drugs to the women and the babies because this is actually helping decrease the HIV and AIDS percentages very significantly. So this is a great and effective way to stop AIDS.